Thank you, Denisha, and good morning to everyone. And thank you for taking the time to join us this morning. Denisha, would you please call the roll of board members?
Yes, Chairman. Norman Boyd,
Here.
Cynthia Rucker,
Here.
Roger Folsom,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Kathleen Ruth,
Here.
Tommy Hopkins, Shane Mobley, Robert Coles, Chairman, that concludes my roll call.
Thank you, Denisha. And by my count, we have a quorum to conduct business. So I will call the meeting to order. On our agenda this morning, we have two different items that we'll be asked as a board to consider for vote, one for final adoption and one for initial adoption. But to move right into the agenda, first of all, the minutes of the previous meeting, September 12 meeting. I'll call on our secretary, Dr. Rucker. She had a chance to review those minutes, find them in order, and recommend approval.
Yes, good morning, Chairman. I have reviewed the minutes from September the 12th, and I found them to be in order, and I do recommend they be approved as stand.
Dr. Rucker has made a motion for approval of those minutes. Is there a second?
Roger Folsom, second.
Roger Folsom has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, the minutes are approved. Thank you, Dr. Rucker. Next, I will move to, this morning there was a care management committee meeting, and ask Anthony Williamson, who's the chairman of that committee, if he would please give us a report.
Thank you, Chairman Boyd. We did have a meeting of our care management committee this morning, and our main item.
I'm sorry, Anthony, I'm having a hard time hearing. Is there something in the volume here?
You hear me? Can you hear me now?
Yeah, that's better.
Okay, sorry. So our care management committee meeting did meet this morning. We had one presentation that was the focus of our meeting this morning, and it was from Daphne Skandrick-Kite, who is our executive director of the Office of Analytics and Program Improvement. And the presentation was focused on all of the efforts that the department puts into data analytics. We have a new system for data analytics that is called the Enterprise Analytics Solution for Everyone, or EASE as an acronym. And this is where all of the data goes in that the department needs is kept. It is fed from multiple sources, as you would imagine, from the CMOs, from the various other components of the department. And this is a new data system that is replacing the legacy IBM system. It will support all of the department's data needs for business decisions. We learned about how the desire is to kind of move from focusing on descriptive data, which tells us things like what happened, to, really beginning to look more at predictive types of data to understand and be able to predict what will happen. This system is also more timely than the prior system, and we can actually have, believe it or not, data for the month of September by October 10th. And it's actually also at a lower cost than the prior system. So I think, as I mentioned, it was a 28-month timeline to design the new system, get it implemented. And it's meant to kind of be the one-stop shop for all of the data needs for the department. The CMS team did come in. There's a certification process that has to occur. They came in, they were extremely impressed by what they saw. And they're in the process of getting us our certification for the system, which we must have going forward, and we should be hearing from them soon. So that was essentially the focus of the report. It was very, very informative, and appreciate the opportunity to share this with you this morning.
Thank you, Anthony. Are there questions or comments for the Care Management Committee, please? Hearing none, thank you very much. And we'll move to the next item on the agenda, which is Commissioner Carlson's report.
Thank you, Mr. Chairman. Before I go too much further, I want to echo what Chairman Williamson just said. Daphne and her team, that's been a long time coming, a project that they've been working on for some time. And he's right. CMS came down, expressed a lot of, they were impressed. They were grateful for all the work. And I'll say it because I know Daphne and her team won't. They actually took it away. CMS is best practices, and I think they want to show other states what right looks like. And I don't know, Daphne might have signed herself up for a little bit of a road show as she goes to show what we're doing and how we got there. And her team is worthy of that compliment. And one of the things I'll say about them is not only they accomplish all these things, they are still remain the most fun in the building in my mind. They're a great, positive, energetic group that knows how to celebrate one another and keep everyone motivated, inspired. And data in healthcare is obviously the tip of the spear. It's one of the most robust conversations from a policy perspective going on across the country, and we're grateful to have them and don't take that for granted. So, but back to my remarks, Mr. Chairman. Good morning, members of the board, and those of you watching at home. It's a beautiful autumn morning here in downtown Atlanta. But as many of you know, since we last met, the state of Georgia and our neighbors across the Southeast have undergone a series of unprecedented challenges resulting from Hurricane Helene, now Hurricane Milton, and a troubling chemical fire in Rockdale County, all at the same time. There's been a loss of life, loss of homes, displacement of families, disruption to supply chains for essential goods and services, tremendous damage to our farmers, foresters, and their families' livelihood. And for many, there's no certainty as to when normalcy, security, and safety will return. Our hearts go out to these families, as well as the first responders, healthcare providers, linemen, and host of volunteers that continue to answer the call for their neighbors. I also want to thank Governor Kemp and First Lady Marty Kemp for their prompt action and attention to these recent events. They've both covered the vast areas of Georgia that were affected, and they have given much needed comfort to both the families and responders on the ground. As for the DCH team, I could not be prouder of their commitment. Their commitment to ensuring all Georgians impacted, both the residents and providers, get the resources they need to keep people safe, especially those most vulnerable, where the slightest disruption of care can have significant clinical consequences. I'd also like to highlight a few people who, as always, rise to the occasion in these circumstances. Anthony Moss, the Deputy Director for HFRD, and Lisa Davies, Chief of HFRD, have continuously worked with stakeholders to make them aware of the various forms of relief and flexibility allowed during these states of emergency, so that this continuation of services remains intact. Evacuations, backup power, water supply, billing, and financial support across the spectrum. They've had a command of the information, which tends to flow and change in real time. and advise providers on the ground as to how to safely and legally deliver care. Anthony, as our actual designee at GMA, has spent countless hours in the State Operations Center, monitoring the changing environment and supplying the decision makers with options and recommendations that can literally save lives. Dr. Toomey and Dr. Rustin at DPH have again provided expertise and leadership in these times, helping lead the healthcare response for the state, as well as our partners at the Georgia Hospital Association and the Georgia Healthcare Association, pharmacists, and countless others. But make no mistake, for many, many families, this is far from over. Long after the TV trucks have gone, there's still a long road ahead. The department and all state partners are committed to seeing this through with you and give you the resources you need to heal and resume your daily affairs in the quickest and safest way possible. And I'd be remiss if I didn't acknowledge the plight of our friends and neighbors in Western North Carolina who even have a further road to go, and our hearts go out to them as well. And so, Mr. Chairman, after that sincere thanks to our team and the others, I want to pivot to give thanks, as we do each month, to some employee milestones to honor some team members that have really committed their professional lives to this department. And we have some big numbers on this one. Starting with Kenneth McBriar in the Medical Assistance Plans Division, MAP, 35 years. That's remarkable. Melinda Ford Williams, also at MAP, 30 years. Denisha Williams, maybe I'll meet her one day. Denisha Williams here at the rostrum with us, 20 years. Thank you, Denisha.
She started when she was 12.
Exactly. Well played, Mr. Chairman. Angela Payne in health planning, 20 years. Carisha Lang, our director of health planning, 20 years. Thank you both so much. Deborah Spalding in MAP, 15 years. Alassa Outlaw Hauser, rural health, 10 years. Kelly Bowles, HFRD, 10 years. Tiffany Boyd, Inspector General's office, 10 years. Nanyamka Glover, MAP, 10 years. Courtney Renee Goolsby, SHBP, 10 years. Kenyatta Ingram, HFRD, 5 years. Amantha Lovett, Dentistry and Pharmacy Boards, 5 years. Jacqueline Hubbard, HFRD, 5 years. And we also like to recognize our new partners celebrating their first anniversary, first of many. Natalie Hakeem, Financial Management, 1 year. Ms. Seam, IT, 1 year. Susan Colvason, OPI, 1 year. Zafon Liu, OPI, 1 year. Fiona Gardner, HFRD, 1 year. Teresa Barber, HFRD, 1 year. Letitia Bolden, HFRD, 1 year. And Carmenilla Bryant, HFRD, 1 year. So thank you all from the 35 years to Denisha and her 20 years, and obviously our first anniversary, guys. We're grateful for your service. Thank you for being such a big part of the department. And as we say around here, thank you for jumping in the deep end with us. We don't take it for granted. So, Mr. Chairman, with that, I'll hand it back to you for the remainder of the agenda.
Yeah, is there questions or comments for the commissioner from the board, please? Hearing none, we'll move into the next agenda item that will be asked to vote on for final adoption. And I'll turn it over to Lynette Rhodes, Chief Health Policy Officer. Lynette.
Thank you. Good morning, Chairman, Commissioner, and members of the board. As always, it is a pleasure to be able to present to you today. Pending approval from the Centers for Medicare and Medicaid Services, effective September the 13th of 2024, the Department of Community Health proposes to revise the methodology for distribution of the supplemental quality incentive payments to eligible skilled nursing facilities and the CMS long stay quality measures utilized. Incentive payments will be paid to skilled nursing facilities that demonstrate improvement in quality in the quality of care rendered to our Medicaid beneficiaries. As previously noted, in state fiscal year 2022, the appropriations bill, and that was House Bill 81, included funding for the department to increase supplemental quality incentive payments to eligible skilled nursing facilities. Using the CMS long stay quality measures, the department developed a quality incentive plan that identified 4 specific areas where Georgia ranked below the national average. As previously noted, those areas included high-risk long-stay residents with pressure ulcers, long-stay residents who received an anti-anxiety or hypnotic medication, long-stay residents who received an antipsychotic medication, and long-stay residents with a urinary tract infection. Effective September 13th, we're proposing to revise the methodology as follows. The department will notify the skilled nursing facilities of the new quality measures no later than September 30th of each year, with one exception, and that exception will be this year. So during the upcoming November 14th board meeting, we will identify the new quality measures that will be utilized for this year. Otherwise, in subsequent years, we will provide public notice of the new quality measures no later than, again, September 30th of each year. This new approach will allow the department to revise the quality measures annually as appropriate. The supplemental payment will be based on each nursing facility's overall ranking in each CMS long-stay quality measure, resulting in the nursing facility receiving a payment proportional to their improvement. Supplemental payments will be distributed to each nursing facilities once per year. An opportunity for public comment was held on September the 18th of this year at 2:30 p.m. via Zoom. Written comments were due on or before September the 25th. We did not receive any oral comments. Additionally, we did not receive any written comments. Accordingly, I will pause for any questions for the board, but respectfully request approval and final adoption.
Questions or comments from the board, please, for Lynette? Hearing none, thank you very much.
Thank you.
Lynette, and is there a motion for approval for final adoption?
Motion to approve for final adoption. This is Kathleen Ruth.
And Dr. Ruth has made the motion for approval for final adoption. Is there a second?
Shane Mobley seconds.
Shane Mobley has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Very
Thank you.
much, Lynette. Thank you for all your work on that. Next on the agenda to be considered for initial adoption, Melanie Simon, our general counsel, will make a presentation.
Good morning. Mr. Chairman, Commissioner Carlson, and members of the board. The Division of Healthcare Facility Regulation presents rules today for initial adoption for adult residential mental health programs. These rules are found in Chapter 111.8.2 of the Department's Rules and Regulations. These new rules are necessary in order for the department to comply with legislation, including House Bill 1083 from the most recent session of the Georgia General Assembly. House Bill 1083 and the prior legislation is codified at OCGA 373200 et sequitur. The statute creates a new facility type that will be licensed by the Healthcare Facility Regulation Division, or HFRD. Under the law, facilities providing adult residential mental health services must be licensed by July 1st of 2025. Adult residential mental health services are defined as a subacute residential alternative service of 4 or more beds authorized to provide psychiatric services for mentally ill persons 18 years of age or older, operating 24 hours per day, 7 days per week, to provide intensive, short-term, non-institutional treatment for transition before or after hospitalization. There are 3 exceptions in the statute. These are facilities that are not required to be licensed. And those include community living arrangements, which are defined by the Department of Behavioral Health and Developmental Disabilities, programs that are operated by accountability courts, beds operated by state or local government. And then the department in these rules has added a 4th exemption for hospitals that are providing these services under the umbrella of their hospital permit. I'm not going to go into all of the requirements associated with licensure of this new facility type, but I would like to highlight some of the key requirements that are noted in the law and in these proposed rules. The owner, administrator, and direct care staff of the facility must obtain a fingerprint criminal background check. The facility is required to have a medical director that must be a licensed and board-certified psychiatrist. The staffing ratio at the facility is 1 trained staff person for every 12 residents. The facility must have a disaster preparedness plan. The residents must be given notice of facility closure or of a change of ownership. And the facility must have policies in place to protect resident rights, including the right to be free from abuse and the right to exercise basic personal freedoms. We will have a public comment hearing on these rules October 15th at 11 a.m. via Zoom. Written comments will be accepted by 5 p.m. on or before October 18th. This concludes my summary of the new rules. We are respectfully asking consideration for initial adoption today of these rules for adult residential mental health programs, and I'm happy to answer any questions.
Questions, comments from the board, please, for Melanie? Hearing none, is there a motion for approval for initial adoption?
Roger Folsom, motion for approval. Mr.
Roger
Chairman.
Folsom has moved for approval for initial adoption. Is there a second?
Second, David Cruz.
David Cruz has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Melanie, thank you for the work you've done on this. Thank you very much.
Thank you.
That concludes the items that we're to consider, and we move to new business. And then I have some closing comments. New business today, as we announced last meeting, it is time for our annual, and we're a little bit late this year, but time for our annual review and vote of officers of the board. At that time, I appointed a nominating committee and asked Anthony Williamson to chair that committee, and he accepted. And Anthony, I would call on you to give us a report of what your committee is recommending.
Thank you, Chairman Boyd. We did meet as a nominating committee and would like to present the following slate. For chairman, Roger Folsom. For vice chair, Cynthia Rucker. And for secretary, Tommy Hopkins.
Thank you. I'm going to ask each of those individuals if they will accept their nomination assignment, if in fact the board votes them in. And Roger Folsom, will you accept that position?
Yes, sir, Mr. Chairman, I will.
And Dr. Rucker
Yes, yes, sir.
and Dr. Hopkins?
Dr. Hopkins is
I'm sure, Anthony, that you've probably had that conversation before, so we will assume that he has accepted, although he hasn't been able to join us at this point. At this time, I'd like to ask if there is an approval for that slate of officers to be approved, and we will do this with one vote. Is there a motion for approval of the officer slate?
Shane Mobley motions to approve.
Shane Mobley has made the motion to approve. Is there a second?
Second, David Cruz.
David Cruz has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, the slate of officers, and thank you all three of you for agreeing to serve in those capacities. And that appointment is effective immediately and will be actually implemented in the November board meeting. At this time, I'd like to I'd like to make a few comments since I've been in this role for a few years. I'd like to make a few observations and thank yous. First of all, it is my honor and privilege to have been asked to hold this position with the Department of Community Health. When I think it was 2009, I was with AGCO Corporation, a Georgia Fortune 500 publicly traded company, and I had a call from Governor Perdue's office and was asked if I would serve on the Board of Community Health. To be honest, I had no idea what they were talking about. But I said, well, sure, I would enjoy that. I'm sure I would as I learn. But so I was appointed by Governor Perdue. And since then, I have been reappointed by Governor Deal and Governor Kemp. And so I appreciate that because I have so much enjoyed this honor and privilege to serve. At the time that I joined the board, the commissioners that I've gotten to know, all of them very dedicated and qualified people. Dr. Rhonda Meadows was the commissioner at the time that I joined the board, followed by the late Clyde Reese, followed by David Cook, followed again by the late Clyde Reese, and then Frank Berry, Kaylee Noggle, and now Russell Carlson. All of the people that I've enjoyed working with and very, very qualified and dedicated people. The other people that I want to recognize are the people that work in DCH, and I've gotten to know several of them. And over the years, I have learned to respect this organization so much because they're so dedicated. The mission of this department is a healthy Georgia. And I can tell you that the people in this department are dedicated to that, buy into that, and they work tirelessly to support that mission. And I thank you very much for that. And last, I want a special thanks to Denisha Williams. Denisha puts all this together and makes sure the trains run on time and we're doing what we're supposed to do. I thank you very much. Anytime I have a question or need anything, I text or phone Denisha and I get a response back, no matter whether it's day or night. And I know she's a very dedicated person. Thank you so much. With that, in my closing comments, I just echo what Commissioner Carlson said. The victims, first responders, and all the people affected by our recent storms and hurricanes, keep them in your thoughts and prayers. And last comment, October 15th in Georgia is early voting. All of us need to go to the polls and vote your conscience. It's a basic right that we have as Americans. Don't take it lightly. I've had people tell me, oh, well, my vote won't count. Well, I know for sure if you don't vote, it won't count. So please do so. With that, the meeting is adjourned, and thank you so much, and you all have a nice day.
Thank you, Mr. Chairman.
Thank you.
Thank you, Chairman.
Thank you.
Okay.